Welcome to the training on occupational health, environment and safety. Let us learn the module on first aid for heat stroke. Before we begin, let's have a look at the key learning objectives. After completing this module, you will be able to define heat stroke and how it is caused, demonstrate how to respond to a person experiencing heat stroke and give him first aid, explain how to prevent heat stroke. Let us first know what heat stroke is and who are more prone to heat stroke. Heat stroke is the most severe of heat-related problems. Heat stroke often results from exercise or heavy work in hot environments combined with inadequate fluid intake. Risk factors of heat stroke include dehydration, age, infants and older people, people who work long hours outdoors, obesity, impairment in sweat gland function, cardiovascular disorder, alcohol usage, medications. Now let us see why heat stroke is dangerous. Heat stroke can kill or cause damage to the brain and other internal organs. Although heat stroke mainly affects people over the age of 50, it can also happen in healthy young athletes. The body's normal ways for dealing with heat stress, such as sweating and temperature control, become inadequate. Call for medical help immediately if you see somebody with the following signs and symptoms: rapid heartbeat, rapid and shallow breathing, high or low blood pressure, cessation of sweating, irritability, confusion or unconsciousness, feeling dizzy or lightheaded, headache, nausea, fainting. If you suspect that someone has a heat stroke, call emergency medical help. Any delay seeking medical help can be fatal. While waiting for medical assistance, follow these steps. Click the images to know more. Move the person out of the sun and into a shady or air-conditioned space. Cool the person by covering them with damp sheets or by spraying with cool water. Direct air onto the person with a fan or newspaper. Have the person drink cool water or other non-alcoholic beverages without caffeine. Apply ice packs to the patient's armpits, groin, neck and back. Immerse the patient in a shower or tub of cool water or an ice bath.
How to treat heat stroke. Heat stroke occurs when the body is unable to cool itself. Knowing first aid techniques to treat this dangerous condition could save a life. You will need a cool area, cool water, a cool bath or damp sheets, drinking water, and a thermometer. Optional, a fan, and sports drinks. Consult a physician for care and treatment advice if you suspect heat stroke. Step 1. Know heat stroke symptoms. Look for a headache, dizziness, confusion, exhaustion, seizure, high body temperature, rapid heartbeat, dry skin, and hallucinations. Step 2. Move a heat stroke victim into a cool, shady area or an air-conditioned building. Step 3. Remove the victim's clothing. Apply cool water to their skin or wrap them in damp sheets. Place them in a cool bath if they are conscious and able to cooperate. Accelerate body cooling using a fan to blow cool air across the patient's skin. Step 4. Provide cool drinking water to increase hydration if the victim is able to accept it. Offer sports drinks to replenish both fluids and salt. Step 5. Continue treatment until you verify with a thermometer that the person's temperature is 101.3 to 102.2 Fahrenheit. Step 6. Keep the person in a cool area and ask them to lie down with their feet elevated. Bed rest combined with rehydration will get them on the road to recuperation and recovery. Did you know? Heat waves result in more deaths in the U.S. than hurricanes, tornadoes, floods, lightning, and earthquakes combined.
take the following steps to prevent heat stroke. Click the boxes to know more. Drink a lot of water. Staying hydrated will help your body sweat and maintain a normal body temperature. Avoid exercising during the hottest part of the day. Try to schedule exercise or physical labor for cooler parts of the day, such as early morning or evening. Taking breaks and replenishing your fluids during that time will help your body regulate your temperature. Wear light, loose clothing. Wearing excess clothing or clothing that fits tightly won't allow your body to cool properly. Do not stay or leave children in closed and parked car. This is a common cause of heat-related deaths in children. When parked in the sun, the temperature in your car can rise 20 degrees Fahrenheit, more than 6.7 degrees Celsius, in just 10 minutes.
How to prevent heat stroke. Heat stroke is a life-threatening illness anyone may experience if exposed to excessive heat. By taking a few common-sense precautions, heat-related illnesses and their potentially serious effects can be avoided. You will need a cool spot, loose clothing, and fluids. Call a physician if heat stroke is suspected. Step 1. Recognize that heat stroke may occur when one's body is exposed to high temperatures or a person undertakes strenuous activity in a hot environment. Step 2. Treat heat cramps and heat exhaustion, which left untreated may lead to heat strokes. Ask your doctor whether your prescribed medications increase heat stroke risk. Step 3. Wear loose, lightweight clothing to help your body stay cool when exposed to hot conditions. Step 4. Find a cool spot like an air-conditioned building where you are able to remain comfortable until outdoor temperatures return to normal. Air-conditioned movie theaters, malls, and libraries are good places to stay cool. Step 5. Drink water or electrolyte sports drinks to stay hydrated, avoiding caffeine and alcohol, which may increase dehydration. Step 6. Avoid sitting in hot cars. Temperatures inside closed vehicles rise quickly, increasing the risk of heat stroke. Step 7. Avoid strenuous exercise during heat spells or schedule activities for the cooler morning and evening hours. It will go a long way in preventing your heat stroke, and your body will thank you. Did you know? Children are at higher risk for heat stroke because their body temperature rises 3 to 5 times faster than an adult's body temperature.